Joining us to discuss some of the latest developments now is Dr. Tom Frieden, former director of the CDC and currently the CEO and president of Resolve to Save Lives, an initiative of vital strategies. Dr. Frieden, good morning. On Wednesday, Dr. Redfield, the current director of the CDC, said the coming months will be, quote, among the most difficult in the public health history of the nation. As of this morning, what is your advice to people as we head into the holiday season?
Right now, we're seeing more cases in more places than ever before. Yesterday, COVID killed more people in this country than any other cause. This is a time to double down on protection protocols. That means masking up and celebrating as safely as possible.
You talk about masking up, and we keep hearing that message, even with a vaccine coming. Pfizer and Moderna still awaiting FDA approval right now. Can you give us a sense, timeline-wise, when we may have that and what that rollout is that follows?
On the one hand, the news about vaccines is really encouraging. They seem to work better than anyone had hoped, and they're coming faster than most of us expected, but they won't come soon enough. Most people will not be able to get vaccine for many months, and that's why it's so important that we're even more careful now, so that when vaccine is finally available, all of us are around to get it.
And current recommendations are the frontline healthcare workers are going to get the first batch, then the elderly. But take us through how that process is going to take place, because there's not enough in that first batch for everyone.
The big picture here is you want vaccine to be trusted so that people will take it. And that means there needs to be complete transparency about all of the data, the safety, the effectiveness rates. There also needs to be fairness to make sure it's fair. And for that, the committee that looks at that, that's an advisory committee of the country's top experts in vaccines and infectious diseases, said let's start phase 1A, as it's called, with healthcare workers and people who live in nursing homes or other senior citizens residences, because they've accounted for about 40% of all deaths. And healthcare workers are out there protecting and caring for all of us, so we have an ethical responsibility to put them at the front of the line. Also, if they get it, there'll be fewer healthcare workers to take care of us, and they may spread it to their home and family and to other patients. So we're starting where it will do the most benefit.
And Dr. Frieden, talk more about the timeline. I know we've talked about this a lot, but when you believe everyone who wants a vaccine or needs a vaccine will be vaccinated?
It's going to be hard to say. The government has some very ambitious, optimistic plans, but the reality is that things can go wrong. It can be a bumpy road. The vaccine is difficult to produce, and mass producing it has never been done before. Already we saw Pfizer reduce its estimate from 100 million doses to 50 million doses. So I think it's going to be many months before all of us who want the vaccine can get it, but it does look like it's coming. And I have to tell you, the data that's coming out of the vaccine is way better than we thought possible. So I certainly would get it the day it's my turn, as long as the FDA approves it, which they're likely to do this coming week, and the data clearly shows that it's safe and effective.
You just said you would get it, and the problem right now is there's still a lot of people who are saying that they're not certain that they would. We've seen former President Obama and Clinton and Bush have said they'll get it on camera so people can see that it's safe. How do you tell people, what do you tell people so that they can believe in this vaccine?
Trust is really important, and for trust, complete transparency is crucial. We have to be clear about what we know, what we don't know, how we know it, how we're going to find out more. And so we have to be honest and say, listen, tens of thousands of people have gotten this vaccine, and there hasn't been a single serious bad reaction. That doesn't mean that when hundreds of thousands or millions of people get it, there might not be very rare bad reactions, and we have to track for that and be very open about it. But one of the things that's really clear is that convenience is really important. And when there is enough vaccine, making it easy for people to get the vaccine, particularly because the vaccines that are being authorized first are going to require 2 doses, 3 or 4 weeks apart. That's a big challenge. Making it easy for people, making the healthy thing the default value, the easier thing to do, whether that's at your doctor's office or at a local pharmacy or for nursing home residents where you're living, that's going to be key to success.
A lot of people talking about that polio vaccine way back in the 60s, if they remember, and those long lines. Dr. Tom Frieden, thank you.